You don't see your neurologist but a few times a year. And oftentimes those visits can feel rushed and it's easy to get overwhelmed. My name's Boster. I'm an MS neurologist at the Boster Center for Multiple Sclerosis. And in this video, I'm going to share with you how to get the very most out of your MS neurology visits. Don't turn away because all of that starts right now. Howdy! Thanks for learning about MS with me, Boster. Going to see the MS neurologist can be a big deal, and you only do it a few times a year. If you're not planful, you risk not getting the very most out of that visit. It can be hectic and it can be a little bit overwhelming, and you may leave the visit lamenting that you didn't get all your questions answered, or not touching on a topic that's really important. In this video, I want to share with you several tricks and tips to help you get the very most out of your MS neurology clinic visit. Grab a piece of paper and take some notes, and let's jump in. My number one tip is to arrive at your clinic visit early. The reason is because there's lots that needs to happen prior to the neurologist coming in to see you. My team, for example, at the Boster Center for MS, does more than just take vitals and go over medicines. They run you through something called the Multiple Sclerosis Functional Composite, which is a bunch of validated tests to assess neurological function. Vision tests, cognitive tests, tests looking at upper extremity function, the PEG test that you might be familiar with, and tests looking at walking speed. All those tests are very, very important to monitor multiple sclerosis, and they can take upwards of 15 minutes to complete. If you show up early, it allows time to collect all that information, and it doesn't cut into the actual visit where we are face-to-face. Similarly, when patients come to visit us, we ask them to fill out special questionnaires that assess all kinds of different aspects of life and function, quality of life, things that you're having trouble with, etc. Those questionnaires are very important, not just to monitor the disease, but to prepare to make sure that we capture all the things we need to talk about during that visit. I look at all those questionnaires before I come in the room. So if you would like to get the very most out of your neurology visit, my number one suggestion is to show up early so that we have time for all of that stuff prior to get rocking and rolling. My second tip has to do with things that you should bring with you to the clinic visit. Please make sure that you have an updated medicine list. Write down a list of all of your current medicines and the doses that you're on. Things can change between visit to visit. You may have seen one of your other doctors who added a medicine or made a change to a medicine, and we need to know about that. We also need to know which medicines are running low that we need to refill. And if you have an updated list, it makes that process very streamlined. Similarly, make sure to bring your ID, and if there's been a change to your insurance, bring your new insurance card. These are things that will make the visit go quickly and be much more successful. Tip number 3 is a really big one. Bring a list of all of your questions written down on a piece of paper. This is super important. As I mentioned earlier, oftentimes it gets overwhelming in the neurologist's office, and we may be so focused on one area that we forget about another area which is also very important. I want you to take pen and paper and write down the things that you have questions about. Tell the neurologist, hey, I have a list of questions. And that way you can refer back to it and make sure that you hit each and every point. This is an important pro tip to make sure that things aren't missed. Speaking of things that you want to bring with you to the clinic visit, I strongly recommend that you bring a village member. Come to the visit with a close personal friend or a spouse or a loved one. This is a super important pro tip, and it helps you get the most out of the clinic visit. That person can review the questions that you've written down and make sure that they all get answered. They can take notes about what the neurologist is saying so that you're not having to split your attention writing and listening. They provide an extra set of eyes and ears. And after the visit, they can help you reflect on what was discussed. You don't get to have MS by yourself. You have it with your village. And I strongly recommend that you bring a village member when you go to see the neurologist. Real quick before we go on. If you found this video to be helpful so far, give it a thumbs up. And also, if you haven't yet subscribed to the channel, please consider doing so. Thank you. It's also important to consider what you're going to wear. Wearing a super tight skirt or a restrictive sweater is not the best option when you go to see the neurologist, because we're going to be doing a bit of the MS Olympics, watching you walk and doing various exams. So wear loose-fitting clothes so that we can be more successful and you're not restricted by your clothing. Getting the most out of your clinic visit is an important aspect to awesome MS care. It's my hope that in this video I've taught you some tricks and tips. If you'd like to further up your game and learn more about MS, click the video that's on your screen right now. And until my next Monday morning video, or my next monthly live stream, or even better yet, the next time I see you at the Boster Center for MS, this is Aaron Boster saying be safe and take care.